Good afternoon, everybody. I'm Zara Arboleta here at Valley Children's Hospital. Thank you for joining us in the first installment of this Valley Children's Virtual Health Series. We're joined this afternoon by Dr. Nael Mhaissen, who is our Medical Director of Pediatric Infectious Diseases here at Valley Children's. Dr. Mhaissen, thank you so much for joining us today.
Thank you, Zara, for allowing me to participate in this, and welcome to everyone who's joining this video stream.
So we started asking questions of our patients and families and community members last week, and they are coming in, as you can imagine, at a very frequent pace. And so let's start off with the very basics. Yes, many of us have been sheltering in place, working from home, or locked up in our offices for the last 10 weeks or so. But there are still so many questions coming in where people want to know, what is COVID-19? What are the symptoms? How can you tell the difference between COVID-19, the flu, a cold, allergies, all of those? So why don't we just start with the very basics, kind of COVID-19 101 for our families, doctor?
Sure. So that's important. Again, establish the basics so everyone knows what we're talking about and what is it that we're dealing with. So COVID-19 is the name of the disease that is caused by this new virus, this novel virus that's called SARS-CoV-2 or SARS coronavirus 2. And it's a virus that the thought is actually spilled over from animals. It's not unknown which animal particularly. And then it came over to actually start infecting people, humans, and it originated in China, and then from there spread everywhere. The disease can cause the mild symptoms of the common cold for the most part, but then in some cases it appears to be much severe than that, much more severe than the common cold or the influenza in terms of what kind of signs and symptoms it presents in patients who have it, especially people who have high risk in terms of weakened immune system or in the ability to fight infection. So I'm talking about people who have other health conditions, older age, or on medication that can suppress the immune system. The signs and symptoms of the COVID-19, many of us are familiar with those. As I mentioned, many of them are shared with the common cold, such as the fever, the sore throat, the cough. Some patients also experience runny nose. And then in the severe cases, that's when people start noticing that they have difficulty in breathing. They're really tired. And then in some of them, they also may become unresponsive, requiring them to be rushed to the hospital. So these are the common signs and symptoms of it. There are also many people who actually get the infected, recover from it without needing to come to the hospital. Those are what we call the asymptomatic cases, asymptomatic infection, which means that someone got in the infection, but they had no symptoms.
So Dr. Mhaissen, that's where a lot of people get confused because they think, I'm not showing any signs, I don't have it, so why do we have to take these precautions? So can you talk more in depth about why it's so important to still maintain these safety precautions, even if for many people they are asymptomatic, which is, as you described, that means they're not showing any symptoms at all?
Right, yes, that's also important. So yes, just because someone does not have symptoms does not mean they cannot transmit the infection. So that's one of the challenging things of handling this pandemic, and that's perhaps why it spread at a faster rate than everyone else was expecting, is that people with no symptoms, silent infections, can still be contagious and they can spread the virus. So it's very important for people to actually follow these measures of social distancing, the face covering, and practice of the hand hygiene frequently to make sure that they do not spread this infection. Even if they are feeling okay, everyone has the chance of actually having this infection and spreading it, whether they feel symptoms or not.
A lot of questions concerning masks. As you see on the news, on social media, even here sometimes with visitors who come in, they ask, why do I need to wear a mask? Can you help educate people on what it means to wear a mask and what that protection really is about?
Right. So out in the community, again, you're grocery shopping or you have to go to, outside of the house for an essential matter, for an important matter, it's recommended, it's highly recommended and advised to actually cover your mouth, cover your nose and your mouth. That way you can prevent or decrease the chances of these droplets from the respiratory tract that all of us actually can produce as we're talking, sometimes even breathing or coughing or sneezing. So the idea is that if all of us cover these secretions, then that will decrease the rate of the spread of the infection. So it's to protect yourself. It's also, and probably more importantly, to protect people around you. And if we all follow these instructions, then the rate of the spread of the infection will decrease tremendously. And that's actually what we're seeing right now. If you look at the numbers, as people are following these regulations or recommendations about the stay-at-home orders, about the social distancing and covering the nose and the mouth, we're starting to see the rate of the spread of the infection is actually slowing down, which is something really good.
Now, what about gloves? Some people ask, we're being told to wear masks, but we're starting to see some signs up in some communities where stores are saying, no gloves, keep the gloves in your car, keep the gloves at home.
Right. So, gloves sometimes give people false sense of security. They feel that, well, if I have gloves on, I don't have to clean my hands frequently, whether it's with the hand sanitizer or with soap and water. And the truth is that it doesn't work that way, because the virus does not seep through the pores in our skin to get into our body. The risk is actually touching something dirty or contaminated with your hand, and then touch your face, your eyes or your nose, and then transmitting the virus that way. So whether the hand has a glove on it or not, the risk might be the same. So I actually do not wear gloves when I'm out and about if I have to be. I don't recommend that people wear gloves. If someone's wearing gloves, then they have to change them frequently, and they have to keep in mind that gloves do not replace the importance of hand hygiene, whether it's with soap and water or with the alcohol hand sanitizer.
We've received many emails and some social media posts, Dr. Mhaissen, from families who are worried about their children who might have immunocompromised systems. They might be patients we've seen here for a long time. So specifically for Valley Children's families whose children face a multitude of issues ranging from serious to maybe not quite as serious, what are some specific tips you can share with families to help ease their fears and also help them to protect their kids and themselves?
So, the common things that we recommend to everyone, I think as parents, we have the responsibility to teach our kids and guide them and show them how these things should be done. So again, we talked about social distancing. That does not just apply to adults, even for children. The frequent hand hygiene, the face covering, for children who are 2 years of age and older, again, as much as possible. So all of these things are important. There are some things specific to children as well that maybe not all families or caregivers pay attention to, which is the frequent cleaning of toys. That's important. If you have toys that are washable, then put them in a washing machine and dry them. That usually is enough to sterilize these toys. And then that particularly applies to children who have conditions that weaken the immune system, whether it's that they're receiving chemotherapy or they are on some sort of medication that weakens the immune system, or they have a disorder that makes their immune system weak. So we have to be extra cautious with children who are like that and make sure that we do everything we can to prevent them from catching this infection. And, if you talk about the measures that we're taking here at Valley Children's to keep our environment safe for our patients and families, there are several things that we've taken. Again, trying to limit the visitation as much as possible. Again, we're trying to keep it safe, but also keep that family-friendly environment that we have. And then we follow strict rules for social distancing at the hospital here and also in all of our ambulatory sites and clinics. Make sure that people have that enough space for social distancing, the 6 feet or longer, reminding people always about the importance of the face coverings with the cloth masks. And some other measures basically to try to limit the chances of people getting infection while they're here. And there's some other measures that are being taken. We can talk about these specifics later if people are interested.
So Dr. Mhaissen, something that had been in the news recently was that primary care physicians around the country were noticing that families were hesitant to bring in their children for normal well child visits, for important things like their annual vaccinations. You want to talk a bit why it's so important, even in times like this, that people still go see their pediatricians and their family doctors for those types of appointments?
Yes, I think that's a very important point. In fact, the health department, California Department of Public Health, just today released an announcement to remind people about the importance of vaccines, the importance of these well-child visits. Because, you know, things do not just work in silo. COVID-19 is not the only infection that's around. It's not the only infection that's threatening the health of our children. So we have to take all these measures that would help us prevent our children from getting sick. And vaccines, immunizations in general, some of the most important measures that we have in our fight against the different infections. So please reach out to your regular doctor, to the primary care provider, and make sure that your child is always up to date on their immunizations. The lockdown and the stay-home orders and the social distancing is not a reason to actually, you know, basically let go of this. We still have to keep close attention to the importance of the vaccine and making sure that the children are vaccinated according to their schedule.
Late last week, Dr. Mhaissen, for those of you just joining us, thank you again for joining us for our virtual health series sponsored by Valley Children's. I'm here with Dr. Nael Mhaissen, our Medical Director of Pediatric Infectious Diseases here at Valley Children's. Late last week, Dr. Mhaissen, the CDC issued a nationwide health advisory alerting all healthcare teams around the country to something that they've called MisC, pediatric multisystem inflammatory syndrome. As soon as that news went out, it went everywhere. And so we're getting a lot of questions from people saying, what is this inflammatory syndrome? Do I need to worry about it as a parent? What are signs I need to look for? I want to talk to people about that a little bit.
Right. So it's actually something that's very, very important. And many of the pediatricians and the scientists are trying to study this phenomena, this syndrome more and more, and learn about it to make sure that we understand it well. And then we provide the best advice to parents and caregivers to make sure they do everything they can to help prevent their kids from getting this syndrome or this disorder. So what is this exactly? What is it that we know about it so far? What we know is that there's potential link between COVID-19 and between this autoimmune disorder, or the thought that it is autoimmune, which means autoimmune means that the immune system is actually acting overboard and attacking parts of the body, parts of the person's own body, rather than just attacking infections. And when that happens, that leads to inflammation throughout the body. In this particular syndrome, seems like that inflammation is affecting the blood vessels throughout the body, and the symptoms of that are different from one person to another, but they're mostly fever, and then diffuse rash throughout the body. Some children might have red eyes. That's because of the inflammation of the small vessels in the eyes. And then some kids also are having changes in their mouth and their lips, where the lips are getting red, swollen, sometimes dry and cracked. And then similarly for the tongue, is getting swollen and red, what we call strawberry tongue. Some kids are having swelling in the lymph glands in their neck, large swelling, quarter size or more. And then some kids also are having swelling of their hands and feet. And all of these symptoms are actually shared with another disorder that looks very, very similar, called Kawasaki's disease. It's something that we know of, that we have been treating and dealing with for a few decades now. The difference about this new syndrome is, again, that potential association with COVID-19, and that's evident by some of these patients having tested positive for the infection or for the antibodies that indicate that these patients have recently recovered from infection. So that's one thing. The other thing that's different than Kawasaki's disease for this syndrome is that these kids are actually presenting at an older age than the age that we're used to see for patients with Kawasaki, that are also presenting much sicker in most cases than patients who present with Kawasaki's disease. And they have other parts of the body that are also affected by this syndrome. So the heart particularly seems like some of these patients, unfortunately, are showing up with severe involvement of the heart muscle, or the vessels that are actually supplying blood to the heart muscle. So some of them present with what we call shock, meaning their heart is not able to pump enough blood to provide that blood supply to the rest of the organs in their body. And then there are some other unique features, such as symptoms that include the gastrointestinal tract, meaning stomach ache, diarrhea, nausea. Some patients are also presenting with headache, signs of meningitis, which means the inflammation around the tissue around the spine. So, and the symptoms of that will be neck stiffness or neck pain. So again, this syndrome is likely related to COVID-19. Again, we say that based on the testing evidence that we see in these patients. And this syndrome is very similar to another syndrome that we know how to treat, we know how to deal with, but it seems like it's a little bit more severe than the Kawasaki's disease that we see frequently.
So Dr. Mhaissen, our pediatric cardiothoracic surgeons and our pediatric cardiologists at the Wilson Heart Center, as you know, are very well versed in treating the symptoms of Kawasaki disease. We are getting a lot of questions from actual patients, heart patients. Are their children more at risk of potentially developing this other condition because they already might have some pre-existing heart conditions?
Not necessarily. So if we're talking about this particular complication of COVID-19 infection, the multisystem inflammatory syndrome, that one most of the time is actually affecting children with otherwise normal heart. So just because someone has a heart condition does not necessarily mean that they are at an increased risk for this particular syndrome. At least that's how things appear so far. Again, we're learning more and more about this syndrome. So most people who get Kawasaki's disease, or most people who get this syndrome, are previously healthy. But in terms of other complications of COVID-19, then yes, the disease could be more severe in someone who has weakened immune system or has other medical problems, especially if it's a significant medical problem, such as lung disease or heart disease. So the same rules to try to prevent infection apply to all of them. But yes, once again, you'll have to be more careful if you believe that yourself or your child has an increased risk of complication of the infection.
And that's a question I'm seeing in real time now pop up on our Facebook and our Instagram feeds right now. People are asking, when do I need to call the doctor? Do these symptoms appear? Is it sudden onset? Is it over days? When do I need to not panic, but maybe call my referring provider, my primary care physician, or my specialist at Valley Children's?
Right. So the main symptom for Kawasaki's or for this syndrome is actually fever. So if your child has fever and it's unexplained, you don't know where this fever is coming from, it's always good, it's always recommended to check with your doctor. So call your doctor, tell them that my child has a fever, and then they'll ask you a few questions to see if there is a concern for this particular syndrome or some other infection, and then they would direct you to the emergency room if needed. Obviously, if the child is really ill, not responsive, having trouble breathing, then that's a reason to call 911 and just come into the ER right away. But it's always good practice. That's something I mentioned to all my patients. Always have your primary care doctor as your first point of contact, except for the immediate emergencies. But again, what is it that you look for in your children? It's the symptoms that I mentioned, and the most important one, the key one, is the fever, especially if the fever is persistent, it's lasting more than 5 days.
So someone has asked if children with chromosome deletions are at higher risk of either COVID-19, MisC, or any other complications related to either one of them.
Unknown, again, because chromosomal deletions or chromosomal abnormalities are different, and some of them are associated with weakened immune system. And in that case, there might be an increased risk of complications of COVID-19. But I'm not familiar with any particular chromosomal deletion at this point that is being linked to the MisC, the multisystem inflammatory syndrome.
So we're getting a lot of questions, and I don't know if you actually have the answer for this one, but there are lots of people saying, when should kids go back to school?
I wish I know. So, but again, I can probably help answer this question, maybe not directly. There are different metrics that we are looking at, the state is looking at, the CDC is looking at to decide when is the safe time or the point where we say, you know what, it is safe to open up things, it's safe for kids to go to school. The reassuring thing is that the percentage of children getting sick with COVID-19 is relatively small, especially when you compare it to adults. So in the US now, the confirmed cases of COVID-19, only 2% of them or so are actually described in children less than 18 years of age. So again, this is a disease that seems to be sparing children for the most part. The challenge is not necessarily about direct infection to children or them getting sick from it. it's the potential risk of children actually acting as vectors to transmit or to spread this infection. So as they go to school, interact with each other, they may get sick, or they may just catch the infection but not have symptoms. And then they have the potential of leaving school, going home, or going somewhere else in the community and exposing other people who have increased risk of actually getting really sick with the infection. So it's a complex issues. Different metrics are being looked at. This is a disease that we're learning about day to day and week to week. So I think within the next couple of months before the new school year starts, I think we're going to have a better idea of the measures that we need to take to safely open up schools.
Thank you, Dr. Mhaissen. A parent writes in, my child has PFAFA. How will we know it's different than her normal fever flares if she does develop a fever?
So that's an important question. I direct that person to actually call their doctor. Most of the FAPA, the PFAPA patients are managed by their general pediatricians and the specialists in rheumatology. I recommend that they contact the rheumatologist and ask that question. I just hate to get specific guidance that may or may not apply to that person who asked.
Another MisC question for you. Are all of the children who we are seeing or have treated or seen in the past, are they testing positive for COVID-19 is what one parent is asking.
So again, this syndrome is relatively rare, and most institutions, most hospitals the size of Valley Children's are seeing a couple of them at most. Especially here in the Central Valley, the prevalence of COVID-19 has been relatively lower than other parts of the state and other parts of the country. So we don't have a lot of these cases, and again, the hospitals around us do not have a lot of these cases to have a solid conclusion that yes, all of them are testing positive or all of them are testing negative. What I can tell the person who asks is that some of these patients are testing positive when we look for the genome, the RNA of the virus. Some of them are testing negative for it. There are others that are testing positive for the antibody and others that are testing negative. And one of the challenging things that we have in medicine, and applies to COVID-19, applies to all other infections that we deal with, is that tests are not always perfect. Sometimes they give us a false positive reading. Sometimes they give us a false negative reading. But overall, considering the rate of these symptoms and how much they're appearing in children, and again, that potential correlation or relationship with COVID-19 is making us suspect that there is an association. So again, we're learning more about this, and we'll, as we know more, obviously we'll take every opportunity to try to educate people about it.
So Dr. Mhaissen, obviously you know, but some people in the public don't, that we don't just treat children, but adults as well, especially of course in our maternal fetal center, yes. Where our specialists there help monitor high-risk pregnancies, either because of a condition that mom-to-be has, or if a problem has been diagnosed in utero with the baby. So we're getting quite a few questions in about what are the effects of COVID-19 on pregnancy, and are there things expecting moms should do in addition to the normal advice you gave about social distancing, washing your hands, wear a mask?
Right. So pregnancy in general can actually put the mother for increased risk of getting sick from particular infections. Sometimes it can also have a risk on the baby as the baby is in the womb, or even after. And we see the common example of that is influenza. And that's why it's always recommended for pregnant mothers to have the influenza vaccine. For COVID-19, we don't necessarily see that same effect. It does not seem that pregnant mothers have higher risk of getting sick from COVID-19 when we compare them to other women who are not pregnant. So again, no evidence of increased risk of illness because of pregnancy. However, whether it's on the mother or on the baby. However, it's always good, obviously, to follow the safety instructions that all of us should be following. Once again, the social distancing, the face and the mouth and nose covering, and the frequent hand hygiene.
For those of you just joining us here on the Valley Children's Facebook page, I'm here with Dr. Nael Mhaissen, our infectious disease expert here at Valley Children's. So one question that we've seen pop up a few times in recent days, actually we've been getting this question for several weeks now, is every year the flu affects thousands of people, leads to the deaths of thousands of people. And a lot of people right now are saying, we don't do these types of mitigation efforts for the flu. So why are we going to this extreme, some say, for COVID-19?
So I wish I can share the rates or the incidence rate of influenza and the incidence rate of COVID-19 and just compare them side to side. Maybe that's something we can share in the comments or on our Facebook page or social media accounts later on. So the reason we are doing what we're doing about COVID-19 is that it is at least 10 times worse than the common cold, worse than the seasonal influenza, in terms of the number of patients it's affecting, number of people it's affecting, and also in terms of the severity of disease. It is it's causing much worse disease than influenza or any of the other common viruses that we typically see can cause. So again, a lot of people ask me that same question. It seems like we're overreacting. I don't think it's necessary. It's just a flu. I wish it was that. It really isn't. So this is one of the worst pandemics we've seen in recent years. And I believe that all of these measures that were taken are appropriate. And in fact, I may even say that some of them should have been stricter or instated sooner.
Some people are asking, again, fever is one of the most common symptoms for COVID-19. And so for people who might have just been joining us in the last few minutes and missed your earlier response, when a child has a fever, when is it time to call the doctor because you suspect it might be something more serious like COVID-19?
So depending on the child's age and depending on what else they have, again, so otherwise healthy child that are not a newborn, if they have fever and they seem like they have, signs of the common cold and they're still active, eating, drinking, it's probably okay to try to give them some of the over-the-counter fever reducers and wait a day or so to see if they're responding or not. But again, if they are too young, so less than 2 months of age, or if they have other health conditions, or if they have some other symptoms that are concerning, especially if they don't have good appetite, they're not eating, they're not drinking, that's when we start worrying about dehydration. That's when we start worrying about some other more serious illnesses. And it's always good to call your primary care provider and ask them about that. I personally tell my patients, call with any fever. I will not be bothered. I'd rather to be safe than sorry. And there are many things that doctors and nurses and health care providers can actually help over the phone in telling parents and caregivers what is it that is okay to try to manage at home and what is it that needs immediate attention. And a lot of people have this concern that because of the social distancing and stay-at-home orders that clinics are closed. There really aren't. At Valley Children's, at least I can tell you that all of our clinics are open. We are available. Yes, there are some appointments that got to be postponed just to decrease the volume, and so we keep the environment safe for our patients and families, but that we are always available by phone. If you have any concerns, please reach out to your doctor or your specialist, and they should be able to help you over the phone or just direct you to the nearest urgent care or emergency department for further care.
Well, that's a perfect segue into another big group of messages we've been getting, which is these are for our families who see our specialists throughout our Valley Children's Network. They want to know when can I come back and when can my appointment be put back on the books?
So if you have immediate concern about your child's health, please call the clinic today and ask for an appointment. So we are seeing, again, the clinics are open. We are seeing patients, especially if they have an immediate or urgent need for evaluation by the doctor or the specialist. And then, but if there's something, again, it's a routine checkup, you can always check with the clinic frequently to see when will be a safe time to either come in or conduct the clinic visit through telehealth, so through video conferencing. And then I know that also our clinic staff is reaching out to families as soon as it's available, as soon as we have appointments available, to make sure that these appointments are scheduled again. So yes, there was a period of time where scheduling of non-urgent surgeries or non-urgent appointments was postponed, but that does not mean that the doctors and the specialists are not available. Again, we are always here, happy to take your phone calls, happy to help over the phone, happy to see you in person if needed.
And if anybody does not have the specific phone number for their clinic, they're always invited to call Valley Children's main number, which is 559-353-3000. Again, that number is 559-353-3000. We're getting quite a few questions coming in again, Dr. Mhaissen. So if you want to briefly remind people again, when it comes to cloth masks, it's not really about you creating a barrier to protect you from getting COVID-19, but it's actually the opposite.
It's probably both. It probably works better for containing the secretions that any of us can spread as they're talking, sneezing, or coughing, but it can also prevent some of these particles as they are floating in the air from getting into our respiratory system. It's not perfect. It's not going to prevent all of these secretions from getting into the respiratory system. That's why it's not, hey, you go out and do everything you want to do, but wear a cloth mask. It's both. Cloth mask and stay at home as much as possible, or social distance as much as possible, because it's one additional measure in our tools that we're using to slow the spread of the infection, but it's on its own is not enough. And someone asked me the other day, why are we, if masks help, why are we staying at home? And if they do not help, why are we wearing them? And what I told them is exactly the same. These are not measures that you take individually. These things work as they are actually done together. All of us are following that social distancing. All of us are following the mouth and nose covering with the cloth face covering. Then I think that would help us a lot slow the spread of this infection. And once again, we are already seeing the results of these measures.
Questions coming in about young infants, newborns, and daycare. Is it safe to take your child to daycare? Because there are many people who do not have the option of working from home and do not have other options other than daycares, but they're hesitant to do so. Can you give those families some advice?
So a difficult question again, and it's really about, and I can't give an answer that would apply to everyone. I think it's a balance of risk and benefit, and also it's about balance of your resources. What is it that you can do? If you can afford to keep your child at home, not send your child to daycare, then that's definitely safer than sending them. If you don't have an option, and you know that at least in your household doesn't seem like you have someone who's at increased risk of infection, in terms of their age, their other health conditions, their immune system status, then it's probably okay. So again, it's a balance of risk and benefit. I think this is a good question to consult your primary care provider on, and just weigh all the options and hopefully do the right thing.
We're getting some questions now about testing. How do you determine which child gets tested for COVID-19? And is the nasal passage test the only one available right now?
It's so I'm going to start with the second question first. The nasal passage testing. So that's the swab, that little tiny swab that actually goes through the nostril and gets to the back of the nose that way, what we call the nasopharynx. So that's the gold standard. That's the recommended way or method of actually checking for active or acute infection. And that's what most doctors and hospitals are actually doing to diagnose patients with active disease. There are other methods of actually trying to find the virus. It doesn't necessarily have to be through that nasal passage. Throat swabs are one of the other proposed sites for obtaining the sample, the specimen to test for the test, although it's not as accurate as the nasopharyngeal or the nasal swab. And then the other specimen that probably has a higher yield of actually showing us that someone has the virus is that sputum, or so basically the secretions from down the throat from their lungs and airways. And if someone unfortunately is too sick and they have to have a tube down their throat to help them with mechanical ventilation, then that's another way of how we make that diagnosis, by getting some of these deeper secretions from the airway and looking for the virus for them. So that's how we make the diagnosis for active or acute infection. The other method that a lot of people have been hearing about lately in the past few weeks or so is actually the blood testing. And that one does not look for the virus in the blood. It's actually an indirect way to tell whether someone was exposed to the virus or not, whether they got the infection in the past or not. At least that's the premise from behind the test. So that's what we call the antibody testing or the serology testing. Once again, doesn't look for the virus per se, but looks for the body's reaction to the virus. It looks for one of the components of the immune system reaction, which is what we call the antibody. The challenge with this test is that we don't know much about how well it performs in terms of telling us, if I have a positive result, is this a true positive or is this a false positive, false reading from the instrument because of, this antibody not being specific to COVID-19 and maybe reacting with some of the antibodies against some other viruses. So because of a lot of unknowns about this test, it's not widely used. One of the proposed uses for this way of testing is actually what we call population health or population surveillance, meaning do mass testing for large populations to see if they were exposed in the past or not, get an idea whether they got exposed in the past or not. So again, these are the different testing modalities. The one that you see done a lot or most commonly is the swab through the nose.
A couple of questions, probably from your families, because these are families with children being treated for valley fever, which our infectious disease team takes care of them. They want to know if children with valley fever are at a higher risk of contracting COVID-19.
So I have not seen that association, luckily. Again, we see a lot of patients with valley fever. It's relatively common in the Central Valley of California, hence the name. But fortunately, so luckily, we have not seen them come in with more infections of COVID-19. We have not seen them coming in with worse disease because of COVID-19. So no, there is no evidence that there is an association of that or that valley fever makes COVID-19 worse. However, like what I mentioned earlier through this video stream is that if someone has another health condition, especially if it's affecting the respiratory tract or the immune system, which is what valley fever does, it does affect the respiratory tracts or the lungs and the airways, then there is at least a potential risk of worse disease with COVID-19. That's why it's very important to follow the recommendations about social distancing, the face covering, and the hand hygiene.
So Valley Children's, our entire region that we serve is 12 counties wide and has 1.3 million children living in it. So this question, it might be tough to answer because each county is opening up at different times, but this is specific to Kings County. Someone who lives in Kings County asked, my county is beginning to open up, including children's sports. What is your recommendation when it comes to kids? Should they be able to play sports or should they continue to shelter in place?
So whether the county is opening up or not, it's very important to keep your child active. Just because there is a stay-at-home order does not mean, just lie down on the couch and play video games all day long. Physical activity is very important for the development and the growth of our children. However, I think there are a lot of things that you can do in terms of physical activity at home or without large social gatherings. I am someone who would be actually concerned about contact sport, about things that will actually break the rules of social distancing. So especially, as someone is playing sports, they're not going to be able, not necessarily at least, they're not going to be able to wear a mask or the cloth face covering. So I would be a little bit cautious about this. Yes, kids have to be active. Sports is very useful for their health and therefore their development. But I think in this situation, I would be very, very cautious about breaking the rules for social distancing. And even as things open up, I would still advise that people maintain the guidance and the recommendation for face covering.
Okay, Dr. Mhaissen, it looks like we covered the large majority of the questions here. Is there anything else you would like to share for our viewers who are just tuning in about COVID-19 and Valley Children?
I just remind everyone that stay strong. Yes, this has affected us, our children, our society in a very impactful way. But please keep attention to the mental health of your children. Talk to them, explain to them why is it that they cannot go to school, why they can't go, again, play sports or go out to the park or something like that. Keep these things in mind as you are dealing with your children at home. Please follow these instructions for hand hygiene, which are important not just for COVID-19, but for all infections in general. And once again, I say, if you have any questions, any concerns, we are always available to help you guys. Please pick up the phone and call if you have any questions for us.
Dr. Mhaissen, thank you so much again. I know you are extremely busy, even busier than you normally are. So thank you for answering questions from our families and from our Facebook viewers. I do appreciate your time. And then a reminder to everybody at home, Valley Children's on our website does have a hub for all things COVID-19 related, including a link to our hotline that is staffed every day. You can go to valleychildrens.org. Again, our main website is valleychildrens.org. And Dr. Mhaissen, thank you again for reminding people about the importance of mental health in this particularly challenging environment. And our virtual health series will continue next week for families, where we'll speak with psychologists here at Valley Children's, as well as our social workers too. So thanks for that reminder. Again, Dr. Mhaissen, thank you. Thank you to all of you who are watching at home. Have a great day and stay safe.
Bye-bye.